Health is wealth is a common adage. If this is true, then it will not be out of place to examine the wealth of a continent or nation by the status of its healthcare system. Today in our special report, the focus will be on healthcare in Africa. Join me as we review the current healthcare trend in Africa. The World Health Organization set a baseline of $34 to $40 a year per person as the minimum for basic health care. According to the International Finance Corporation, an arm of the World Bank Group, only few countries in Africa have been able to meet this baseline. Also, healthcare in many of these African countries continue to experience downtrend. Africa generally is considered to have the worst medical facility and care in the world. According to the World Health Organization Global Health Expenditure Database, the domestic general government healthcare expenditure per capita for 2018, Estonia ranked first with $1,142 per capita. Seychelles follow with $620 per capita. Botswana ranked third with $374, and South Africa fourth with $284 per capita. From the bottom rank, Congo Democratic Republic with $2.79 per capita. South Sudan with $2.88 per capita, and Cameroon with $3.22 per capita. The low funding of healthcare and corruption that depletes further the low funding in some of these nations further heightened deprivation of quality healthcare in the continent of Africa. Low funding of healthcare and unavailability of quality healthcare services that is not necessarily caused by lack of qualified professionals has led to uncontrolled medical tourism. In Nigeria, medical tourism is a common phenomenon and a buffer of social status among the elite to embark on medical tourism abroad. In estimates, African elites spend over $1 billion on medical tourism annually. The public health facilities are left in a very deplorable condition while the leaders jet to the Western world for state-of-the-art medical care at the expense of the taxpayers. Some of these leaders, including presidents of some of the nations, have even died abroad while on medical tourism. The question is, if these leaders know the difference between quality healthcare and poor healthcare, why do they fail to make change that is so much desired? Many factors have been attributed to the nonchalant attitude of these leaders to the development of good healthcare facilities in their countries. Notable is the issue of trust. Two factors can be considered when it comes to the issue of trust. One is the secretive nature in Africa, especially among the leaders. Many leaders will not want their medical conditions in the public, and because of that, they feel more safe to travel abroad where their medical condition will not be revealed. Another is the issue of a failed system. Despite the fact that these leaders are the one making policies and decisions and implementing them, they do not trust even the policy they have made. Neither do they trust the implementation of their policies. so they cannot entrust their lives to this system. Another important reason that have been attributed to medical tourism and continued deplorable states of healthcare in Africa is that some government officials see medical tourism as opportunity to siphon the country's fund through extra codes. In 2020, the COVID-19 pandemic led to the closure of air travel, and many of the African leaders could not access their popular medical stores abroad. That singular global event should have taught African leaders the necessity to develop home medical fronts. Unfortunately, there is a doubt if any lesson was learned. For example, there is an ongoing uproar and protest against the current president of Nigeria, who is currently on medical trip to the UK. Nigerians in UK had been holding days of protest to see the president return to Nigeria and enjoy the same medical care that average Nigerians are exposed to. One other important reason also attributed to the failure of the leaders to do a thing about improvement of the healthcare system in Africa is attachment to colonial masters' apron string. Some of these leaders believe unless they are cared for by white medical personnel, they may not be cured. This condition in healthcare system within Africa's space has led to brain drain, which is another hole already draining the possibility of survival of healthcare system in Africa. The medical personnel are poorly paid and even not paid salary for months in some cases. Yet the countries where African leaders fly to for medical care are attracting the African medical professionals who will then attend to those jetting out of Africa for medical care abroad. At the overall receiving end are the helpless masses of Africa who could not afford to travel out of their countries to source medical help abroad. Many of these die of preventable illness, and life expectancy in Africa continue to go down at an alarming rate. Since we began this report with an adage, why not end it with another adage, which is, what is in the soup that the chef who prepares it is careful not to taste it? That is food for thought. See you in our next special report.